So today we are going to talk about 4 or 5 major gaps in the modern medicine. The first one is inadequate management of the chronic and multifactorial diseases. Now we know that modern medicine has evolved remarkably and evolved in a fantastic way for acute and infectious diseases, particularly with high precision diagnostics, pharmacotherapy, and surgical innovation. However, it often underperforms in addressing the chronic and lifestyle related diseases such as type 2 diabetes, hypertension, cardiovascular disorders, and autoimmune conditions. These illnesses are multifactorial in origin, driven not only by the genetic and biochemical factors, but also by the environmental, psychological, and lifestyle influences. The biomedical model tends to isolate diseases, processes, and targets, particularly in view of the specific pharmacological agents that are failing to consider the patient's holistic context, as a result of which the disease does not go away completely and is treated more symptomatically. We can say that rather than offering a cure or sustained remission, modern interventions typically result in prolonged pharmacological dependency. For instance, despite widespread use of anti-diabetic medications, global prevalence of diabetes has risen from 108 million in 1980 to 537 million in 2021, and it is around 640 million now. And this demonstrates a clear failure in disease containment with the modern medicine. This raises question about the completeness of the model focused solely on the disease suppression rather than functional restoration. The second factor we will consider is rising adverse event and burden of polypharmacy. And that is quite common in modern medicine, particularly if you are trying to control the symptoms rather than eradicating the cause. A critical gap is in increasing the burden of polypharmacy and adverse drug reactions called ADR, specifically among elderly and multimorbid population. A meta-analysis published in JAMA estimated that ADRs or adverse drug reactions are responsible for over 100,000 deaths annually in the United States alone, making them leading cause of mortality. Many drugs are prescribed to counter the side effects of the other medications, and these create a therapeutic cascade. Moreover, the reductionist approach of treating symptoms in silos often lead to redundant investigations and interventions, compounding patients' burden and escalating the healthcare costs. This drug-centric model contrasts sharply with the goals of integrative and preventive health systems that emphasize reducing pharmacological load through the lifestyle change, natural medicine, and patient self-regulation strategies, which are quite useful and are usually patients' first choice. As healthcare becomes increasingly expensive, particularly in aging population, the unsustainability of the over-medicalization without holistic alternatives become evident. The third important point is neglect of the psychosomatic and mental health dimensions in the typical modern medicine scenario, primarily when drug treatment is instituted without the whole holistic management. Despite mounting evidence linking to psychological stress and emotional dysregulation with physical disease outcomes, mainstream healthcare systems continue to compartmentalize mental and physical health. Stress-related disorders such as irritable bowel syndrome, fibromyalgia, chronic fatigue syndrome, and various dermatological conditions are frequently underdiagnosed or mismanaged due to limited psychoneuroimmunological lens within the conventional training. Surveys across NHS clinics show that 30 to 50% of patients with chronic physical symptoms also suffer from undiagnosed anxiety or depression. The biomedical paradigm often lacks tools for addressing the mind-body interface, despite studies confirming that emotional resilience, social support, and mindfulness practices modulate the hypothalamic pituitary adrenal axis, called HPA, and reduce the systematic inflammation. Integrative medicine addresses this shortfall by incorporating the mind-body therapies such as meditation, yoga, guided imagery, all of which have documented neurochemical and clinical benefits. The fourth important point is patient disempowerment and lack of personalization with the modern medicine therapy, and that is a significant gap. We know that we generally say patient choice, but we can say here that on standardized treatment protocols and algorithmic care pathways, modern medicine often sidelines the patient's narrative, values, and preferences. This can result in feeling of alienation, lack of trust, and poor adherence or compliance. A 2022 UK-wide survey revealed that 67% of patients wished that they had more say in their treatment plans and were interested in natural and holistic alternatives if they were proven safe and effective. The one-size-fits-all approach neglects the nuances of individual constitution, lifestyle, and even genomics, which can significantly impact treatment outcomes. While the emergence of personalized medicine and pharmacogenomics holds promise, their innovation remains largely inaccessible and technologically intensive. In contrast, traditional systems like Ayurveda, which offer Ayurgenomics, Chinese medicine, and naturopathy inherently practice individualized care and tailoring intervention based on biotypes, lifestyles, and environmental contexts. This gap in personalization within mainstream healthcare underscores the urgent need for integration with modalities that already prioritize such customization. Thank you.